Hello, I'm New Jersey Health Commissioner Mary O'Dowd. The Department of Health is committed to ensuring that our children have the healthiest possible start in life and receive the services they need to reach their full potential. In 2011, Governor Chris Christie signed a new law making New Jersey the first state in the nation to screen all newborns for congenital heart defects using a simple pulse ox test. This new law enables nurses and doctors to identify infants who may have hidden serious heart problems before they leave the hospital. If undetected and untreated, congenital birth defects can cause physical and mental disabilities or even death. This non-invasive, low-cost test measures the percent of oxygen in an infant's blood, which is an indication of whether a baby's heart and lungs are healthy. As some of you may know, the screening involves placing a sensor on a newborn's right hand and foot to measure blood oxygen content. When a potential problem is detected, further testing is performed, and if a critical congenital heart defect is found, infants receive care right away. I am happy to report that the law has already saved lives. In September 2011, a day after the law took effect, Dylan Gordon of Sussex County had a pulse ox test at Newton Medical Center, which led doctors to discover a heart murmur. Baby Dylan had life-saving cardiac surgery when he was just 9 days old. Governor Christie and I met baby Dylan and his parents, and they believe the pulse ox law saved Dylan's life. Following Governor Christie's action, the Federal Department of Health and Human Services added this screening to its list of recommended tests for newborns nationwide. During the first 3 months that New Jersey's law was in place, 98% of babies born in our hospitals received a pulse ox screening, according to the CDC report. In the same report, hospital nurses indicated that administering the pulse ox was a familiar skill and was easy for them to integrate into their routine tasks. And that is important because it's simple for nurses to incorporate this screening into their well baby nurseries and neonatal intensive care units. Most babies are born with normal hearts, but according to the U.S. Department of Health and Human Services, congenital heart disease affects approximately 7 to 9 of every 1,000 live births in the United States and Europe. There are many types of heart defects, which can range from mild to severe. Approximately 25% of babies with heart defects have a critical condition. A critical heart defect requires prompt diagnosis and treatment. These babies are at risk for significant disability or death. The pulse ox can identify heart defects before infants get sick or show signs of problems. We expect to detect about 100 congenital heart defects in infants each year, enabling early treatment and preventing life-threatening injury or death. A new investment of $1.6 million is proposed in the department's budget for newborn screening. This $25 million program tests every infant in New Jersey and provides follow-up education and treatment. Our budget allows us to increase testing from 54 to 60 metabolic and genetic disorders. As a result of Emma's Law, signed by Governor Christie, new testing will include 5 lysosomal storage disorders, which impair the body's ability to break down certain substances like proteins. Testing will also begin for severe combined immune deficiency, which prevents infants from fighting infections and can be fatal. This new investment reflects our continued commitment to New Jersey's most vulnerable residents. We know that nurses are on the front lines and that they will save lives and ensure a brighter future for New Jersey's newborns. Thank you very much.